Okay, we're just about at the top of the hour. Amani is a wonderful student, and she was like the first to turn on her camera. So she did it again, and she's going to lead the way for our other participants today. So again, if we those of you that are courageous enough to turn on your videos, thank you for letting us into your home or apartments or wherever you are on campus. It's really great to have you all here today, and it's especially wonderful to have such a distinguished group of panelists to help lead this discussion around innovation in public health and healthcare. And we really did seek out the leaders for this, and they were very gracious with their time. And so I'd like to welcome everyone and to this particular session. During this session, our distinguished panel of industry leaders will discuss the societal impact of a career in public health, entrepreneurship and innovation in healthcare. And they will also share important trends with regards to the future of technology in healthcare and public health and future opportunities for new innovations. To help lead the discussion, joining us today, we have an alumna, Hope Watson. Hope Watson is a proud alumna and Temple 30 Under 30 honoree. She's presently a data scientist at Current Health. She's worked to develop machine learning models in areas of health in the healthcare space, ranging from preclinical research and development in pharmaceutical pipelines at Alexion Pharmaceuticals to healthcare delivery systems involving payer analysis at Haven Healthcare. Hope focuses on the area of AI interpretability and liaising between clinical expertise and statistical analysis. Next, we have with us Dr. Ravi Rajan. Dr. Rajan is a member of the college's Board of Visitors. He's a healthcare entrepreneur and board certified urologist who has been practicing innovative and patient-centered urology in Bucks County since 2000. Dr. Rajan has also been named as one of Philadelphia Magazine's top docs. Next, we have Tom Gordon. Tom is also a member of the college's Board of Visitors. He is presently the Senior Vice President and Chief Information Officer for Virtual Health System. It's one of New Jersey's largest health systems. He has more than 25 years of information technology experience in healthcare and banking and extensive leadership in healthcare as well. Mr. Gordon is also the 2019 recipient of Philadelphia's CIO Orby Award, something you can Google if you don't know what it is, and Tom can also share a little bit. Last but certainly not least, we're absolutely thrilled to have Dr. Nicole Quick join us today. Dr. Quick is a clinical informatics physician at Epic Systems. She brings over a decade of diverse healthcare and public health experience to Epic's work to improve population health and preventative care. She is part of the Epic Health Research Network team, focusing on rapid sharing of new medical knowledge by bringing observational data directly to physicians and researchers. That's so important. She is trained in preventative medicine, public health, and addiction medicine, and has led several large-scale leadership positions in government services. I want to thank each of you for being with us this morning, and we can certainly give you each a minute to share anything that you want to add before we get move to questions. Okay, maybe Dr. Quick, do you have anything that you'd like to share first?
Yeah, and I guess just that thank you for having me. I enjoy very much talking with sort of the next entry into public health, the next workforce. I think public health is a very diverse and exciting field to be in, and I look forward to sharing today some of the insights I've gained and just thanking everyone for choosing public health to go into. It's extraordinarily important and a lot of fun.
Good news there. Okay, Tom?
Yeah, I would echo what Dr. Quick said. I mean, there was already a ton of innovation happening in the medical and healthcare space, and if there's anything good that came out of the pandemic, it's that those things really took a giant leap forward, and nobody's looking back. So I think the future is bright, and there's a ton of opportunity in IT, informatics, and healthcare in general.
Thank you, Tom. Ravi, did you have anything you wanted to add?
Yeah, I echo the sentiments. Public health is in the front pages now, and I think it's a great time to be in public health. Whether it is taking care of patients or setting policy, it can be for governments, it can be for industry, public health is needed more now than ever. And I'm glad we have such a nice flow in the college to help.
Thank you so much, Ravi. Hope, you're the, I guess, most recent or close to what would be those coming out and of college and moving into the workforce. Is there anything specifically you want to share before we move to some of the questions we prepared?
A little bit of echoing what other people said, but I think the fact that you finally have health coming into the forefront of the conversation, usually it's economy, media, those kinds of things. The job growth, especially in epidemiology, I think is going to surge. So this is really interesting. And although we're talking about sort of societal, entrepreneur, and just like impact as different kinds of things, they're obviously really tied together, as pretty much everything's technology focused at this point. So that's all.
Excellent. Hope, actually, we're going to start with you. Can you start the conversation by talking about a little bit more about what drove you in particular to pursue a career in public health?
Yeah, so I think for me, it comes down to the why. I've gotten sort of a skill set now in healthcare, but also really heavy in technology. And so I could have used these technology skills that I developed to quite literally sell people more dog toys or furniture, or essentially create algorithms to keep them on social media for longer. That just doesn't really speak to me or the kinds of things I want to be working on. And although it may sound like a little self-righteous, it's actually kind of selfish, because I think if that we had healthier, less stressed out people, that on average, our interactions with each other would be a lot better. So it's kind of this idea that, like, you know, the foundation of every good society comes with them being healthier. And this takes a lot of different practitioners and people who are interested in the tech side of things. I will say when I entered college, which was not that long ago, it was 2013, feels like a long time ago now. I feel old already, but I wanted to be an orthopedic surgeon because I had injuries and knee surgeries and different things. And I did the whole pre-med thing. And then I picked up a public health minor, actually, and I got really interested in biostatistics and essentially being able to affect thousands of people with just these models and different sort of mathematical things that I can do. And so this was kind of the pivot point where I decided I didn't want to be an individual physician. I very much understand the necessity for it, but I was kind of okay looking to do something different. So I said, okay, I'll take a year to do a master's degree, which I did over in England at Cambridge, and kind of see what I wanted from there. So I think for me, I just realized I wasn't as committed to the idea of med school at the time. And this biostatistics field and epidemiology, I kind of kept gravitating toward that. And that's kind of, you know, where I am. And I think when I think about those two fields in particular, I think the future of it comes down to a lot of genetics. It comes down to a lot of how can we get essentially the hospital systems and EMRs to talk to each other, so the electronic medical record systems. So those are the kinds of things that, you know, it was a little bit of being cognizant of where I wanted to go, and then it was a little bit of just, you know, your path throughout college as you change a lot in those 4 years, and maybe even change majors like I did. But that's kind of, you know, how I decided to pursue it, is that health is a really good space to sort of give you that impact, that feel-good impact as to why you're doing what you're doing. I just didn't think I was going to get that in other fields. You're on mute.
Thank you. This is a great segue to talk to Dr. Quick, actually. Can you talk a little bit about, I would imagine that most that are participating in this session know what EPIC is, but can you talk a little bit about EPIC, how EPIC's actually been in the forefront and sort of driving the innovation with regards to the patient at the center and the communication, you know, with the electronic medical record system, and also specifically how health data can be used to drive outcomes at a population level?
Yeah, absolutely. So very important information sharing, being able to access timely data in a meaningful way, that existed pre-COVID. COVID just highlighted that even more. Being able to have timely data on what we're seeing as far as outbreaks and treatment outcomes is critical in response to the pandemic. One of the greatest opportunities, I'd say, going forward for public health, meaningful public health, is utilizing these, the data that we have across the country on patients, on surveillance, on public health outbreaks, early detection, and so forth. We have an opportunity now to sort of bolster all of the public health IT infrastructure, both public and private partnerships, and really improve how we look at data so that we can, in a timely manner, not only detect potential future pandemics, respond to them, see how treatments are working, and so forth. So I think that is a very important area of further development that can happen that COVID sort of highlighted. I also think it's important to point out one thing that is maybe a silver lining of the pandemic is people, and this is across the board, public and private, being willing to share information in a way that maybe didn't happen pre-COVID. So that's something that we should celebrate. We have done really well as a society in sharing information, looking at how quickly we developed vaccines and how people were willing to share sort of medical and I'd say technological insights during COVID is sort of unique. And I think that's something that we should all try to continue going forward.
Thank you so much, Dr. Quick. Would you also share any advice? Do you have any advice for Temple seniors and young alumni who are hoping to really step into the intersection of healthcare and information technology? Like they have an interest and they've got their public health degree, but what's next? What would you recommend?
Sure, I'll give a little background on kind of to echo some of what Hope said. Public health is incredibly diverse, and how individuals end up in public health is a very, I'd say, sometimes winding road, including myself. I started out as an emergency medicine doc and ended up in through a series of events in county level public health, and now at Epic working in clinical informatics and really using observational data to drive population level health outcomes. So what I want to reiterate is somewhat kind of what Hope touched on. Take opportunities as they come to you and explore them. Public health is literally, in my mind, anything that affects population level health. And there may be opportunities that are given to you or potential projects that you may think, well, was this something I was ever interested in? I don't know. Where it will lead, you never know. And so one thing I like to tell everybody entering public health is be very open to potential opportunities. I think the intersection between public health and technology is going to become more and more important. I do agree with what other speakers have said. Sort of, in my mind, I look at it this way. Public health and population level health, you have a set amount of resources no matter what. You're trying to affect the population of the entire country in a positive way. So technology can help us either take care delivery outside of the traditional things that we used to think of. You know, telehealth is a great example of that in the pandemic. We really looked to streamline ways to reach more populations, or in a better way, or in a more cost-effective way. Innovation is essential in targeting our limited resources to make the best outcome. So what is my advice as far as the, how to break into that? Be very, I say, open to opportunities and where they may take you. And public health is incredibly diverse, and there is a lot that you can do out there, whether you want to focus in on something very specific like biostatistics, epidemiology, all the way to being involved with sort of more of the health promotion. There's just a lot of opportunity out there, and you just need to be open to where it may take you.
Great advice, Dr. Quick. Thank you so much. This is a great segue to Tom. Tom, in your daily work specifically, how do you see technology changing the landscape of healthcare and public health? And you are like boots on the ground. You're in it day in and day out. Can you speak a little bit about that?
Absolutely. Thanks, Natasha. That's a fantastic question. As we're hearing, right, telehealth, remote care, remote work in general, this new term that healthcare is talking about, the digital front door, redesigning primary care to incorporate all those things, the surveillance pieces that go along with that, adding in tools like machine learning and artificial intelligence to help where appropriate, it are just dramatically changing the conversations that we have every day, and they're, you know, on a high trajectory. It's no longer like a year-long conversation. Things are happening like that. And so I wanted to talk about, you know, one of them specifically, you know, as healthcare services have, you know, begun to resume during and after COVID-19, the ways patients now interact with their providers and their care institutions, their clinics, et cetera, you know, it's changed dramatically, and we don't see that ever changing back. And so, for example, you know, instead of, you know, people automatically heading to their local clinic or local emergency department for something that would, you know, be less acute, something minor, right? Patients aren't doing that. They're looking for those abilities to have that encounter happen via telehealth, or potentially even you know, something, a screening tool that could be filled out, and where somebody can assess and a determination can be made on what are the next steps, you know, what are the preventative care steps. I think Hope was talking about preventative care. I mean, that's becoming a big piece of it. We've seen, and you know, I was just looking at a research document that came out from Epic. ED volume across the entire country is down something like 36%. That's exactly where we are. And so we are seeing about 36% less patients come to the emergency department. However, most of those cases that are coming are higher acute than what they used to be. So what we've seen is, you know, people that really need to come to the emergency room are still coming, but those other less acute things are either not coming, or they're having something done through telemedicine or whatnot. So it's kind of changing you know, how we're going to have to look at things. As a result of that, most, if not all, healthcare organizations, you know, that can't afford to ignore the technology around this thing we call the digital front door. And there's a bunch of capabilities there, right? And it's telemedicine. So it's, you know, video, maybe multiple video platforms. It's mobile applications, it's web portals, and all this has to be connected with your EMRs, you know, like Epic. And so Epic's a good example of trying, you know, they are helping to try and build that infrastructure to allow all those different pieces to speak, because at the end of the day, it still has to be easy. It has to be easy for the patient. It has to be easy for the clinician. We're also seeing a big transition to home monitoring, this whole hospital at home philosophy of where, you know, it exists today, right? We all have, you know, I shouldn't say we all, but the majority of people have good enough bandwidth at home through Comcast or Xfinity or some other service. And, you know, blood pressure cuffs, scales, even surveillance type tools are starting to be deployed into the home. And so we think that's really going to continue. And the pandemic has really helped push some of that forward, because people now don't always want to go to the hospital. So it's a challenge that we have to now meet and say we'll meet patients where they want to be met. As an IT guy, I am a big believer in KISS strategies, keep it simple. And so I spend a lot of my time trying to make sure that the strategies that we put together around digital are purpose-built and simple to use. Because at the end of the day, if they're not, then, you know, we're gonna end up chasing our tails. So at the end of the day, I think the biggest thing that's changed in my daily work process from an IT and informatics perspective is, you know, again, if anything, that pandemic has moved the needle and the conversations to meet those needs and meet those more modern approaches to healthcare needs. And those conversations that may have taken, you know, a year or so in the past are now happening in a week. Decisions are getting made, and things are happening to meet patients where they want to be met.
Thanks so much, Tom. You know, for new alumni or recent grads that are interested in this area. They've got their maybe public health degree, or maybe they're a clinician, but they're really interested in the data side of health. What technical skills would you recommend that they work to develop for success?
Sure. So that's a great question too. And so I'm gonna tackle that two ways, Natasha. I'm gonna say two critical skills that I think are really important for technical, but really anything we need to do is communication and presentation skills. And communication skills in IT are paramount. You have to really be able to communicate well, and you have to be able to listen well. There's an old IT saying that goes something like, I gave you what you asked for, even though it's not what you wanted, which means there's a breakdown in that communication. And so that can have dire consequences in health IT and healthcare if the two groups aren't able to share their ideas and communicate well. Then the finished product might not come out right. It could be wrong data. It could be a slow process. It could be a breakdown. So communication skills are paramount. And I believe in the skill with communication of the 5 Bs. Someone had taught me many years ago, and I never forget it. The 5 Bs being be brief, baby, be brief. Meaning, you have to be able to make sure you can make your point and then sell it, which then takes me to presentation skills. So effectively presenting your idea, even in the IT world, right? We have to come up with innovative ideas, solutions to problems. So you have to have that technical skill, but just as important, you have to have the presentation skill. So you want to be able to effectively present your idea, and stories work really well. So present it in some kind of business story, success story that goes along with it. You still want to grab people's attention. And even in this world that we're living in now, right? So a lot of times when you would have people around a conference room table or, in a meeting, the communication was a little bit easier at times. Now we have Zoom meetings, we have Teams meetings, we have WebExes. And so you really have to be able to make sure you're able to tell your story and capture that audience's attention, because it's easy for people to lose attention. So I think those two skills are really critical. On the technical side, that analytical ability to look at data, understand what the data is telling you, and then how that story comes together is key. There are so many tools around machine learning, artificial intelligence, big data. There's probably folks on this call that are really interested in research. And over the years, the research tools have gotten really, really good because of big data. You still have to understand what you're trying to go after, but the tools have really enabled great things to happen there. The EMR vendors, other big data vendors, Microsoft, Amazon's getting into the game. So the ability to pull data together and really analyze it, instead of taking months and months and months, can be a matter of days, hours at times. So really being able to understand and harness those tools. And then lastly, I would tie something into what I call a new skill. This is a first, Natasha. I want to copyright this one, but I call it website manner. And I think it's a critical skill that technology and informaticists folks need to have, but also physicians, nurses, and others, because all of a sudden our encounters via Zoom and Teams meetings and other forms are things that didn't exist before. And so we need to all learn how to have that good technical skill of being able to hold a meeting via these tools. So, you don't want to, I don't know how to share my screen. I don't know how to do this, but you want to be able to understand on the telemedicine side how to conduct that telemedicine visit with a patient, even clinician to clinician pieces. So I think the website manner is going to be a new tool set that we're all going to have to learn, because I don't ever see it fully going back to the way we were before.
Well, we could say they've all heard it here first, Tom. So thanks so much. Webside manner. Love it. It's thank you for that. I want to transition to Dr. Rajan because you're a clinician. So before we maybe jump to the intersection of how entrepreneurship can help solve problems, or thinking of yourself as maybe a clinician and entrepreneur. Do you have any, do you want to react to what Tom was talking about in terms of sort of the website manner? You've been using telehealth, I'm sure, in your practice, but do you want to react to that?
Well, I don't go in many WebExes as Tom does. Most of mine are one-on-one with patients. So for patients, it's they have the ceiling fan going and we can't hear them. And a lot of my patients are older, so they don't know how to use telehealth. The connections are easy, but for many patients, how to turn on the microphone, how to turn on their camera is difficult. So as simple as it is, we got to have it simpler for the patients, especially the older ones. And as Tom said, a lot of us have bandwidth, but not everybody. And it's going to impact the poorer communities. As we become more tech savvy, they're the ones who are going to be left behind.
Thanks so much, Ravi. Can you talk a little bit about in what ways you're a clinician, you run a successful practice. In what ways can healthcare and entrepreneurship work together to help solve problems?
I think it's a must for us to move forward. The entrepreneurs are there to solve problems. And we are in a great time where there's a lot of data, and whoever can collect the data, analyze it, and then figure out a way to use it to improve people's lives, especially their health, that's where the entrepreneurs will win. And without money, without funding, the best ideas won't go anywhere. So the entrepreneurs will solve a problem, and public health will improve from it.
Thank you so much. So for those that may be interested, we likely have some participants here that are not sure what direction their career might take them, but they might have a great business mindset and consider themselves entrepreneurial. What advice would you give to those that aspire to be entrepreneurs in the healthcare space?
It's going to sound counterintuitive, but I'll say fail and fail often. Get out of your comfort zone, do things that you think will work, but you will learn. Every time you fail, you will learn. People who don't fail aren't trying. Go out and don't be worried about failing. It will make you better.
Thank you so much, Dr. Rajan. I want the next question. I'd like to present to Hope to answer first. What advice would you give to CPH or public health seniors and young alumni who are exploring a career in public health specifically?
Yeah, so a couple things, public health is not just the public sector. I think most jobs are in the private sector. This is the biotech companies, the pharmaceutical companies that I'm sure lots of recent college grads are afraid to kind of go into pharma because of such the bad reputation that it has. And the reality, there's some realities to that, but there's also a lot of opportunity to really embed yourself and learn about these patient populations, whether it's rare disease or something else. One of the other things I just want to quickly touch on is that people are so like data driven, but a lot of the stuff that I work on and the stuff that you've heard about, like connectivity issues, I actually work in remote patient monitoring. And most of those people, why we're not getting their data, we're not getting their heart rates, we're not getting their SpO2, is that their internet's not fast enough and they're not connected properly. And so part of my job, and whenever someone's asking you to do a report or do something data driven, it's sort of asking yourself, like, do I need data science to solve this problem, or can I sort of solve the problem that's in front of me with my job with what I know and what patients and people are telling me? So that's one thing. Jobs are all over the place in the private sector. And then the other thing that I would really encourage is that I think a lot of people are talking about is, like, don't be afraid of quantitative routes. I think that limited me. I was originally afraid to take all the math and other things, like even during my undergrad, and started to do that in my graduate degree. Why is this important? Whenever you're trying to solve a problem, someone's going to ask you to quantify your impact. And so having some sort of like literacy around that. And then the final thing is the technical literacy. There's, you don't have to take computer science to essentially have an opinion about whether the EMR systems are working for like your patients, or you don't need to essentially you don't need to solve problems, technical problems with technical skill sets to point out that technical problems exist. So what do I mean? There's a whole bunch of jobs, like a product manager, for instance, is one of the most recent jobs, where essentially you have some sort of baseline understanding of technology, but you're really more about like the business application and making sure the customers, and in telehealth, it's the patient on the other end of the call, is getting their needs met. So, you can leave it to the techies to essentially they can come up with an algorithm to make the noise of the ceiling fan less on a call. You can automatically have the video and audio turned on. So those are things that can be solved, but you need people to actually escalate those issues. And there's literally jobs dedicated to all the technical usability problems that we have with the stuff that we've built. So I think that was a lot, but yeah, I think for me, I've had some job changes and things that were tumultuous. I had job interviews that I realized they weren't going to be the right fit for my ethics. And those are the kinds of things that I've decided not to compromise on early. If something feels weird, or I don't like how they might be using data and those kinds of things, I stay away from that. And my logic is I'm way too young to sort of go down the wrong path, that I don't want to find myself working with certain types of people on certain kinds of problems. So I think just work on what you're passionate about and make sure that the people around you are good people and like-minded. That's a lot of advice. That's more life advice than anything else, but hope it's helpful.
Oh, thanks so much. We actually talked a lot about values in the last session, and so and how important that alignment was. So it's great to hear you speak of the same thing and elevate the importance of that. My last question before we transition to sort of just general questions from our participants, and we already have a couple in the chat, some interesting ones. This is for all the panelists, and whoever feels most comfortable can certainly answer, but where do you see the greatest opportunities in the next 10 years in healthcare, and where, in healthcare and also in the public health space? I don't think ever imagined that we would see a pandemic. Maybe there are probably some leaders that had the foresight to know that this was on the horizon, but where do you see us going from here?
I'm happy to jump in and talk from a public health standpoint. I think in my mind, one of the greatest opportunities is expanding on the public-private partnerships that we've seen sort of increase during this pandemic. And I think we should all be well prepared for, if not, I mean, certainly COVID is with us for the long haul. So what does this mean going forward? I think we should work as a society to be better prepared and continue to prepare. So there was sort of systematic defunding and underfunding of the public health infrastructure in this country for a long time. And opportunities now is to let that not happen again. And that involves all the things we've been talking about. It's not just the public sector, it's the private sector, and it's innovation. We really have limited resources, and to affect positive population level change, we need to streamline that and do our best and do population level interventions in the most streamlined and cost effective manner. So I see that as a great challenge as well as a great opportunity. So there is a lot of opportunity for new minds to come into public health and figure out how that happens and how we make that meaningful change going forward.
Anyone else want to speak on that before we move to questions?
I can speak a little bit on that. What I'm most excited about are wearables. When someone comes to see me or other physicians, we see one point in time, and once wearables are, say, can gather more data, we'll now have a better window of what is occurring with the patient. a friend of mine who's a urologist in Philadelphia, Greg Dean, has come up with this innovative product where there's a sensor in the diaper. So if a patient is in a nursing home, there's a Bluetooth that goes to a signal, and then the nursing home knows the diaper has to be changed. Family knows the diaper is wet. They know how long it will take for it's changed. Small innovations like this will change how we deliver care and hopefully improve
Yeah. And
Yeah, just
oh,
sorry, go ahead. I was just going to say, I'm excited for the non-pharmaceutical interventions, like the wearables that are coming, the health apps. The key thing there, though, is people have to actually want to use it. And I think the usability and the patient experience around that stuff, you can make the most innovative technology, but the barrier is people don't want to use it or it's uncomfortable. And those design aspects are like really what people should focus on as we kind of move toward that technology helping us. That's the only thing. It's amazing, but people have to use it and it has to be integrated into their lives and they have to want to use it and not think about it. Doing things really simple for the customer or the patient is actually really hard from a technical point of view and solving those kinds of things, which is kind of what I'm in the crux of each day.
Yeah, and I would just wrap that. Yeah, I would just wrap it up by saying, I think that hospital home, which encompasses all the wearables and whatnot, I think it's a really great opportunity to meet patients where they are. So I think that the technology pieces are the abilities are just going to grow exponentially over the next 3 to 5 years. So it's really exciting to see what the possibilities from a data side and just a general healthcare perspective. The conversations, and I'll add public health in there, the conversations that are now taking place around disparities in care, that conversation is now elevated to a whole new level. And, there's so much data that shows that those disparities in care, it really do exist. I mean, I'm in Voorhees, New Jersey. I can tell you, just 7 miles away in Camden, it's completely different between the two populations, and the data shows that of life expectancy and some of these basic things. So when you start looking at the data, not only at a problem to solve, but there's a business use case there too. So there's financial impact. There's taking care of the disparity. There's looking at just the having a the difference food can make. And so really that is a tremendous opportunity that healthcare is, and you see it in our area that we're in here now. We're fortunate that many of the healthcare organizations are taking a step into that to try and change that curve. But you see that conversation happen in all over the country. And so I think that will also pay off dividends over the years, and that'll affect us all having better care and cheaper care, hopefully, and more efficient care. So I'm really pretty bullish on the path forward around both the technology, but also the fact we're looking at disparities in care the way we are right now.
Excellent, Tom. Thank you so much. So we're going to transition right now to the questions that we have from some of our panelists, and I again encourage all of the questions from the participants. I encourage all the participants to post your questions in chat. You can also use the reaction feature to essentially raise your hand to ask a question. So we'll read the first one. In the interaction of public health and technology, what do you think about the progress of interoperability in our current healthcare system? How could we as public health workers improve the patient awareness of the technology uses in their healthcare experience?
I'll go talk about the first question first. Interoperability is improving every day. When EHRs first came on the horizon, the government said the EHRs have to speak to the government, but not to each other. As time goes, those are changing. There's still hurdles. Which format are we going to use? The different EHR vendors want to use their format or have their own ideas. So it's not perfect, but it is getting much better. And soon, if someone goes to the ER, hopefully their records will be available no matter which hospital or physician they saw. We should all have it readily available to give the best care and the cheapest care.
Thank you, Ravi. Tom, did you want to weigh in?
Yeah, I would agree 100% with Ravi. I mean, we've seen great improvement from where things were. There's been incentives to do that. There's been regulations, but it's at times gotten so good that the physicians are like, oh my God, you know, I don't even want to see all this information because it's coming in from all over the place. There's another, you know, I think it's a great thing that's happening March, you know, in a couple more days, is the Cures Act, which is requiring all results to be released to patients immediately, and also physician and, well, I'll say clinical notes to also be released immediately. So if you have a patient, those things have to show up. You know, continued stuff like that is going to drive better interoperability. It's going to drive different conversations, changes in how healthcare, you know, operates and interacts. So, you know, I think it's the technology piece there is really improved. There's still a lot of challenges around the rules and regulations, which at times are very outdated, and outdated when we look at public health. I'm not just saying this because Dr. Quick's on the phone. Epic has a pretty good, you know, look at saying, hey, we're gonna share information, and we're not going to, because we think it's better for public health. But not every single buddy is in that same bucket, and from state to state, rules and regulations are different. So that there are some challenges there, but there's a whole wealth of data that I think, you know, and we're seeing it could really benefit public health around pandemics and different things, as long as we keep patient privacy protected while we're doing that.
Thank you so much. So I had another question that came through individually from the chat. For those, for the panelists, if you were entering, you know, this career today, Les probably hope because she's closer to coming out of school and into the workforce, how would you change your preparation in any way to facilitate entry?
I can start. I, you know, would hope kind of echo this a little bit. I do think getting exposure to sort of some of the tools needed for data analysis and so forth are critical. Would I change my preparation? I think I would have listened, and this maybe isn't that relevant to this group, but I'll share it because it's sort of an interesting pathway in. In medical school, they had us all take sort of an aptitude test for which specialty you matched. And my number 1, 2, and 4 were all in preventive medicine. So it was aerospace medicine, OC medicine, preventive medicine. And at the time, I'm like, I don't know what that is. I'm going into ER because I like to do procedures and I like the shift work. And I changed partway through, went and did a preventive medicine residency, did an addiction medicine residency after that. So would I have changed that? Maybe, maybe not. All of your past experience is sort of useful in getting you where you are. But I do think getting broad exposure to what public health is, the practice of public health in the public sector, public health in the private sector, seek out opportunities to talk to people that are in the different areas, because public health is such a diverse field that you don't really know everything that's out there. And I'd say that is probably the advice I would give. And just, even if you think something might not be the most interesting to you, if you have the opportunity to explore it, it's probably worthwhile, because you never know where you're going to find yourself presented with an opportunity where that skill set might be useful.
Really excellent advice, Dr. Quick, and thank you for sharing your story with us here today. Well, we're just coming up on a minute, and we seem to get moved to that main room so quickly. I just want to say thank you to all of the panelists. I think there's a question here. Do either of you want to try to tackle this? You can also answer it in the chat if we get bumped to the main room. But I want to make sure that I thank all of our panelists for today. for joining us. Thank you for your expertise. Thank you for your advice to our students. We're sure that that this group is going to do great things, and we appreciate you investing in the next generation.